Welcome to this episode of the Partovi Effect. My name is Mrs. Madi Partovi,
And I'm Dr. Ryan Partovi.
and I'm sure that we've all heard in the news that Walmart is giving their word to eliminating synthetic dyes and 30 other chemical ingredients from their brand of food. If you're not watching on YouTube, food in quotes. I mean, well, by 2027, right? So we'll see. And it still doesn't mean that their stuff is going to be healthy.
Well, I'm just marveling at the fact you just launched right into that.
I did.
But okay. Yeah, I mean, so here's the thing. As I've mentioned to you before, Hershey's, Mars, they've all said, oh, in years past, oh, in 2 years, we're going to have everything. In 5 years, we're going to have everything. And then and that deadline goes by and they still have food coloring in their stuff. So to me, I am highly skeptical that this voluntary, approach is going to be effective. I think you have to regulate, you have to ban these things. I think that I don't fully understand why RFK Jr. is not willing to go that route because I feel like he knows better. But I think that there's like a knee reflex kind of knee jerk on the conservative side of things, like, oh no, we don't want to ban anything. Oh no, we don't want to regulate more. And it's like, well, but you can't actually have a free market unless you have regulation. Because if you have unconstrained regulation, or if you have unconstrained markets, they're going to naturally collude with each other. They're naturally going to be, what will develop is cronyism, right? You'll get crony capitalism, which frankly we see a lot of that today. So the only way you truly can maintain free markets is to have regulated markets. Um, and that is especially the case in the food and drug realm, in my view.
Yeah, so I don't hold out much optimism when it comes to news like that.
Yeah. I mean, I think that it's good virtue signaling.
Yeah,
It's like, hey, come to Walmart, right? But I mean, Walmart has not been the friend of the people ever. So I doubt they're starting now.
yeah.
They have low prices though. That I think we can all agree on. But at what cost is what I would say.
Yeah, right. Ask yourself that.
Yeah. Um, Anything else you wanted to talk about?
N no. Well, yes. And I really want to launch into men's health, especially particularly testosterone levels. When you open my world about it, everybody kind of knows about testosterone replacement therapy because it's widely marketed. And I would assert that, most people know that that is available for them, right?
Hmm.
What they don't know are the other levels of testosterone therapy that are available to them that may not have the like reduced fertility or the testicular shrinkage effects,
Mm.
um, and the host of other effects like loss of hair,
Hold
sleep issues.
on.
Bless you. Bless you. Bless you.
Excuse me.
And the host of other side effects, sleep issues, and um, I mean, you could eliminate, most of them. But what are
I mean, I think
the?
you've done a good job,
Thank
actually.
you.
I think that certainly you can get a cholesterol increase, a heart disease increase if you go too high. You can actually get overconversion into estrogen, which can cause gynecomastia, which is enlargement of the breasts, can increase your risk of male breast cancer. I mean, there's all sorts of things that can happen with testosterone injections, which are very common. or even overdosing testosterone cream. With the testosterone injections, which I see this very often, people coming into the practice, and the problem with the testosterone injection is it's an injection, so your level is basically going like this, and then it gradually goes down until the point that you get another injection, and it's like this again. So you kind of get this pattern, right? It's like this is becomes your hormone pattern. And um, so the problem with that is that you get these highs and these lows, and at the high sometimes you get excess symptoms, and then at the lows sometimes you get deficiency symptoms. And so I prefer a more steady state, consistent level, which you get with uh, topical applications. And the same with the injections is true of the pellets. Some people do pellets, but you still, I mean, when you get the pellets injected, it's kind of like this. It's maybe a little bit of a slower curve, but then still there's this curve, and then So the only way to really avoid that is by doing the testosterone topical replacement.
Okay, so there's oral, there's
Well, oral, really, you can't do oral. So
okay.
oral is going to get pretty quickly conjugated by the liver and cause a lot of increased risk of heart disease. So you don't do oral testosterone.
Okay, so I know so many young men that are on this natural tea stuff that's oral.
Well,
That's not that
it may not be testosterone. It may be something like a botanical formula that boosts testosterone. And
okay.
we can get into that, but those do work. Some of them do work. And there are definitely herbs that increase testosterone level either by increasing the signal from the brain to the testicles or by increasing the precursors to the testosterone in the body or by improving testicular function or some combination thereof. Sometimes blocking the conversion of testosterone into estrogen or dihydrotestosterone, which are the two main metabolites of testosterone, the breakdown products of testosterone. And yeah, so
Okay. Testosterone 100, 101.
101, yeah.
Why is it important?
Why is it
Or
important?
why is the optimal function of testosterone important?
Yeah, so you're talking about men's health. Well, in men's health, having healthy testosterone levels help maintain muscle mass is, I think, the biggest thing. And with muscle mass, you're able to do more. You're able to, as you get older, you're able to having higher function. You'll be able to get on and off the toilet because you'll have good muscle mass. And so I think that as people get older, they get tend to their muscles tend to atrophy. They tend to have greater and greater mobility issues, greater and greater impairment in their functioning. You know, harder time walking around, harder time running, certainly harder time lifting things. As muscles atrophy, also your basal metabolic rate goes down, which increases insulin resistance, increases risk of diabetes, increases weight gain, fat gain specifically. So there's metabolic consequences of low testosterone, um, through the muscle mass atrophy. Those are the big things. I mean, certainly there's neurological benefits to testosterone. It helps with sex drive. It helps with confidence. It helps with sexual function. One of the main sort of underdiagnosed causes of erectile dysfunction is actually testosterone deficiency. Not that, oh, you have a Viagra deficiency, right? It's that you don't have enough testosterone, and as a result, you are not able to maintain your erection, or maybe you have um, premature ejaculation. So a lot of sexual dysfunction can be tied to low testosterone or elevated estrogen. Because again, one of the most common things that happens as men get older, especially over age 50, is that the conversion of testosterone into estrogen increases because the activity of the enzyme aromatase, which is the enzyme that converts testosterone into estrogen, increases. So yeah, I think that Testosterone, other health benefits of testosterone, it helps with libido. We mentioned that. Helps with, drive, like ambition, motivation, mental fortitude, the ability to deal with stress and difficult challenges in life. People who go on testosterone therapy often feel like, oh, I feel like I can do anything, right? It kind of is the hormone that gives men that confidence and capacity um, to, really it's a I would say probably the most powerful anxiolytic, which is an anti-anxiety medication that we have available, especially for men, but even in low doses for women. Um, what else? It helps with chronic prostatitis. So you have a lower risk of prostatitis if you have good testosterone levels. Interestingly enough, prostatic hypertrophy is largely driven by the conversion of testosterone into dihydrotestosterone or DHT, as well as estrogen. And so low relative levels of testosterone to estrogen and dihydrotestosterone can increase the risk of prostatic growth, including prostate cancer. So, um, if once you have prostate cancer, dihydrotestosterone and testosterone can potentially aggravate it. But I think that for general prostate health, in the absence of prostate cancer, keeping estrogen low, dihydrotestosterone low, and testosterone at a healthy level is the way to go. And a healthy level, so the normal range is going to be, or the optimal range really that we look for is 600 to 800 nanograms per deciliter um, in an adult male. So sometimes we can go a little higher or a little lower, but again, that's sort of the generally I would say accepted amongst those of us who are testosterone aware. Now, you can go to some doctors and they'll say, oh, a 400 is just fine. I would say 400 is definitely borderline low, if not low. And 400 to 600 is kind of suboptimal, but some men do well at that level. Below 400, you definitely need to be doing something to boost your testosterone, either to boost it or to replace it. And then over 800, it just really depends if the estrogen and the dihydrotestosterone are staying healthy. Some men can push it up to about 1,000, but anything over 1,000 is an unhealthy level. So, unhealthily high level. So hopefully that's clear.
Okay.
Anything else on testosterone 101 that we,
I would like you to speak on what are the environmental things um, that affect testosterone in 2025. Um, yeah, largely environmental, largely, I mean, there's the food and the products that we use, and um, anything else that you think would cover that,
yeah, good
that
question.
directly affect healthy testosterone levels.
Yeah. Well, there's a lot of potential answers to that question. I would say that the first thing that comes to my mind is that we have a lot of endocrine disrupting compounds, mostly xenoestrogens in plastics and in things like BPA, bisphenol A, and parabens, which are found in a lot of like creams and over-the-counter cosmetic products. And that are just present in like plastic food containers, which if you store your food in plastic and then there has any fat in the food at all, it will leach some of those into the food, and then you consume them, and then they get into the body and can wreak havoc. And the way that they wreak havoc is that um, in so there's a hormone that your pituitary secretes called gonadotropin releasing hormone, and gonadotropin releasing hormone, it travels to the testicles and tells them the cells in your testicles that produce testosterone to make the testosterone. Um, when the signal that tells the pituitary there's been enough, we've had enough testosterone, we're good, is actually when the testosterone starts to spill into estrogen. When that happens, the estrogen signal is what lets the brain know, okay, well, you have enough testosterone. When you have a lot of xenoestrogens, one of the things that's happening is that those chemicals are able to activate the estrogen receptor. And as a result, they're telling the brain there's plenty of estrogen here because you have these estrogenic compounds that you're constantly being exposed to. So it sends the signal to the brain, there's plenty of testosterone. Meanwhile, there's not actually, right? So it gives this false signal of sufficiency when there isn't sufficiency. Um, and then there's also directly cytotoxic effects on the testicles. So the a lot of the toxins, especially the fluorinated pesticides and heavy metals, have direct cytotoxic effects on the Leydig cells of the testicles, which is where the testosterone is produced. Um, and so sometimes that can also, by attacking directly where the testosterone is produced, you can get a reduction in testosterone there. Also, you can get autoimmune causes. You can get autoimmune orchitis, where there's an autoimmune, um, basically attacking of the actual testicles. The immune system attacks its own testicular tissue. That usually gets provoked either due to an illness or a vaccine. We know that vaccines increase the risk of autoimmune diseases. And especially if you already have an autoimmune disease, your risk of a second autoimmune disease goes up substantially um, with each additional vaccine. And there's also a phenomenon, and that's really because of the toxic elements in the vaccine. So the adjuvant is the component that is increasing an immune response. And if you get the vaccine, you have an adjuvant, and then you're exposed to something that is similar to testicular tissue, it can then trigger a response to the the you know the response to the vaccine ultimately is going to be an autoimmune condition. And we see that, the handful of studies that have looked at the long-term risks of vaccination have shown increased risk of allergies, eczema, atopic conditions, autoimmunity, and neurodevelopmental disorders. So this would fall under that broader group of immunotoxicity because some of the elements of vaccines are toxic. Does that make sense?
It does.
Yeah. Okay, good. And trying to think. Oh, mycotoxins. Yeah. So mycotoxins are mold toxins, and those have direct effects on the production of melanocyte stimulating hormone, which has, and I forget whether it's a direct precursor to GnRH, gonadotropin releasing hormone, or whether it has like a I think it has a regulatory effect on GnRH. In fact, I want to actually take a look at it because I think it's worth showing you guys. Biotoxin pathway. So for those of you who are not on YouTube, I apologize. You have to go to YouTube if you're interested in looking at this. So I'm going to share my screen and we'll go ahead and I don't know how to make that full screen. But anyway, so the mycotoxins combine with HLA susceptibility. So this is a genetic susceptibility, which is present in 24% of patients or people. And then you end up with Um, Basically, cell surface receptors involved in the immune response that are going to lead to increased cytokines, which have an effect directly in the hypothalamus, suppressing MSH, that master regulatory hormone, melanocyte stimulating hormone, which then can lead to reduced androgens. So reduced MSH can cause the pituitary to lower its production of sex hormones, particularly testosterone in men. So that's the mechanism by which that happens. And obviously there's a lot more to biotoxin illness, but it's true that a moldy house can actually cause you to have low testosterone. Um, okay, let me stop the screen sharing. Oh, down there. Okay, great. Um, Anything else that you want? Any
Just
questions about any of that or?
no, I just wanted to summarize in a way that's super, super understandable.
Sure.
So if a man is still, while taking testosterone replacement therapy and living in a moldy house and eating at Jack in the Box, McDonald's, and Burger King and Wendy's, uh, and wearing Axe cologne.
Oh yeah, we didn't even talk about that. So, fragrances are a big thing, and actually fragrances are present not just in Axe body spray, but probably shouldn't name any particular brands, but it's
Body spray.
Axe body spray. Come get some. Anyway, no. The reality of the matter is that these these often contain parabens, which, as we mentioned earlier, are xenoestrogens and foreign estrogens that inhibit the signal, the feedback signal that tells your body to produce more testosterone. So whether it be, scented dryer sheets, the fabric softeners, whether it be, the other laundry additives you use that have scent to them, whether it be cologne, perfume, scented soaps, scented air fresheners, scented cosmetics, aftershave, body spray, deodorant, those little tree things that hang in the car, other air fresheners that hang in the car or go over the blower in your car. I mean, anything that's got a synthetic fragrance, and synthetic fragrance is anything that's not an essential oil. So you know, it's made in a lab, is definitely um, highly likely to have a xenoestrogenic effect, and as a result, is going to potentially lower testosterone production.
Yeah, that used to be a huge deal breaker for me a long time ago when I was in the dating world. Um, what are you wearing? Oh, no synthetic fragrance.
Not a problem with me, I'm
Nope.
sure.
It was so refreshing, when I met you and you were just so tuned into the world um, of healthy eating and well, genotype eating. And um, yeah, you didn't use any of that.
Yeah. Well, it's actually, I mean, it's a deal breaker for us in when we're hiring people to work with us. I mean, especially to take care of our boys. I mean, we have two boys and I don't want their testosterone inhibited at all. So it's important that we don't have, or mine, frankly, for that matter. And so if they're around us and we're constantly getting exposed to those scents, it's a really, I mean, I feel it. I'm pretty sensitive
Oh yeah, it gives me
to
a headache.
chemicals and stuff,
Yeah.
but yeah, it definitely makes a difference. And it makes a difference staying away from that stuff. So
Yeah. I remember you wanted to look for a natural pine sol.
yeah, the pine saw. Yeah. And so I found like the original pine saw, which they still sell, which is made with the pine wood stuff, but apparently it's still they put a bunch of other stuff in it that's synthetic. And so I was still having like horrible headaches every day that the housekeepers would come and use that. And I would just feel sick for the entire rest of the day. And we would like have to run the fans at maximum. And eventually
Yeah.
we switched to just totally all 100% natural, essential oil, vinegar, peroxide, isopropyl alcohol based cleaning stuff. I mean, we really don't use anything. I mean, it's all like seventh generation or cleaner at this point, which is we are not this podcast not sponsored by seventh generation, which I believe was actually bought out by another company recently. But anyway,
Gotta look out for that. I
yeah,
mean,
watch out.
yeah, I'm laughing because I'm whenever we're over at your cousin's house, he messes with you and he busts out the radioactive fabuloso.
Can't believe he even has Fabuloso in his house. That stuff is so disgusting. I'm sorry. I want to see whether seventh generation was purchased by another company because I don't want to unfairly malign them. Um, okay. Seventh generation. Let's see here. Acquired.
Unilever.
Unilever required them, the Anglo-Dutch consumer goods company, for $700 million. Well, at least they got a good payout. So this is back in 2016. I mean, I still think they have, just based on the ingredients, I still think they have pretty good products. And it looks like their CEO was still the same CEO um, for the last 20 years, but then I guess he retired in 2021. Now we have a new CEO. Yeah, I mean they've still received a lot of good rewards for sustainability, but I'm sure that they're third-party independent companies that are probably better, you know. Maybe we'll get one as a sponsor and then we can share all about how great their products are. Wouldn't that be wonderful? Hint, hint. But yeah. Yeah, I mean, in terms of what's available at Target, that's probably the best brand that they have there, actually. Um,
I'd like to start addressing the um, most people know that testosterone replacement therapy is available to them, right? And they don't know, um, or they might or not might not be aware of the side effects or the multitude of side effects. In our naturopathic integrative holistic approach, it is a rare case. Like you talked about that 80-year-old patient, who said, okay, I don't have I had 6 months to me is like 2 years. Okay, just put me on straight on
he may have
TRT.
said 20 years. It was like a lot,
Yeah,
right? Yeah.
put TRT.
Yeah.
All right. So apart from those that kind of nuance, um, why would somebody start directly with testosterone replacement therapy? And then I want you to talk about that and then what else is available. Because you said there are three other levels that are available,
Yeah, and that I recommend frankly starting with. Yeah.
right? Which
Like
people
like in
probably,
in addition to just basic stuff like we've talked about with um removing the toxins from the environment, and also I don't know, I don't think we discussed um obstructive sleep apnea. Obstructive sleep apnea is another big thing that can cause low testosterone because it actually deprives um, the hypothalamus and the pituitary of oxygen, and as a result, you can end up with decreased GnRH production, so you have decreased testosterone production. GnRH is that gonadotropin releasing hormone that tells the testicles to make testosterone. So, um,
so
yeah,
is it
I
that
mean,
sleep apnea can affect your testosterone or
right.
testosterone can affect your
Well,
sleep
sleep, yeah,
or
so
both
so
ways?
sleep apnea can absolutely because of the oxygen deprivation can lower testosterone. And then having lower testosterone can make, for example, insulin resistance worse, which can cause you to gain weight, which can make sleep apnea
Sleep.
worse.
Okay.
And the interesting thing about I mean, a lot of these things are mediated by insulin resistance, and a lot of um, yeah, I mean, what you're pointing to is the fact that the body is a complex system with a complex interconnected web of different metabolic processes. And a lot of what's driving things like obstructive sleep apnea is inflammation, and a lot of that inflammation can come from the same sources that can affect testosterone levels. So there is a lot of overlap.
Okay,
Definitely with regard to, did you have a question about
no, go
that?
ahead, finish your thought.
Well, I was going to say that basically with obstructive sleep apnea, that can result, that can be more of a symptom, frankly, than a cause. I mean, it can cause things, obviously, but it can also be a symptom of insulin resistance, prediabetes, diabetes. It can also be a symptom of mycotoxins, the mold toxins we talked about, allergies, um, toxicants in the environment. There's volatile organic compounds that can cause reactive airway that can lead to obstructive sleep apnea. Or frankly, sleep apnea that maybe seems obstructive, but may or may not actually be obstructive. But it definitely, people can have apneic events because that airway gets inflamed, and that inflammation can come from a lot of different places. And that then leads to the low testosterone. And as then when you have low testosterone, it causes everything we talked about earlier about the muscles atrophy. And then as a result, you end up with a lower basal metabolic rate, slower metabolism, and then worse insulin resistance, which then leads to worse blood sugar metabolism, which then leads to more weight gain, which leads to more, greater risk of obstructive sleep apnea. So
Okay.
it can definitely help to do the BiPAP or the CPAP, that kind of thing. And I'm not saying not to do those things, but I'm saying while you're doing those things, also find out what's causing your sleep apnea.
Okay, so let me finish my thought, right? So if you're injecting yourself with TRT, you're still living in a moldy house, and you're still eating junk food, and you're still wearing Axe, and if you're still not addressing, your sleep issues, then it's an uphill battle, right? Given the whole intricate web of
Well, it's not only an uphill battle,
it's like a canceling everything out.
yeah, you're going to be swimming upstream. So the point is that you have to deal with a lot of the environmental things. And there's also nutritional dietary things, which I don't think we've mentioned yet. Things like essential fatty acid deficiency. If you don't have enough omega-3 fats, if you're not, taking your fish oil or getting enough omega-3s from the diet. There's definitely, which is almost impossible to do these days. Um, if you're not getting sufficient zinc, if you're not getting um, if you're being overly exposed to any heavy metals, um, you know, um, if you're not getting, I mean, if you don't have enough fat in your diet in general, I would say, or if you're having too many omega-6 fats and not enough omega-3s, the ratio's off. So, dietarily, if you're eating too many refined carbohydrates and sugars, and so you have high insulin, and so therefore with the high insulin, that's going to also impair those Leydig cells, and you're not going to get as much testosterone production. So, a lot of it does become like a vicious cycle where high insulin leads to low testosterone, which contributes to high insulin, which leads to lower testosterone. It's like a downhill, positive feedback loop.
Okay, so I'm really getting that in our impending testosterone program, it would have integrity to ask or have a questionnaire that lists all these environmental things and um, or just that kind of education.
Yeah, like an educational document that kind of explains, like, hey, first thing you need to do is take care of these environmental things. And by the way, if you have any concern that you might have sleep apnea, and we can list some of the symptoms of sleep apnea, please have yourself checked out by a sleep specialist and do a sleep study and find out. Because if you do, then that's something that obviously also needs to be addressed. And that in the meantime, I mean, you don't have to go straight to a CPAP. There's also like a mouthpiece and some other devices that you can implant now, which I'm not crazy about those, but I mean, some people like them. Inspire and stuff like that help with sleep apnea. But those things can help. Honestly, I haven't seen those have a great effect on testosterone level, but I think that they can be helpful. Um,
Okay. Um, so by now, I we're well aware of conventional testosterone replacement therapy. This is synthetic, with the whole world of side effects. What else is available?
Well, I mean, I think that, before we get into what else is available, we should talk maybe about where those side effects are coming from. We did talk a little bit about how, mostly when you're getting testosterone, the levels are going, if you're getting shots or pellets, levels are going to go up and then they're going to come down and then they're going to come up. So anytime you're going from here to here, you're going to end up with excess. So if you were to basically get a testosterone shot and then 3 days, assuming it was bioidentical testosterone, which I'll get to that in a second, but you get a testosterone shot 3 days in, you're going to check your testosterone. It's going to be high. It's going to be over 1,000, right? So given that, um, it begs the question of where, are the side effects coming because of the testosterone or because the dose is too high, and then you also get at the bottom you get low testosterone, and those are some of the other essentially side effects. um, and then the other question I have, or the other point that's worth mentioning, um, is that the form of testosterone, injectable testosterone, they use predominantly um, testosterone cypionate, testosterone enethate, and testosterone undecanate. And, all of those forms are going to be not bioidentical. They're not going to be the exact same testosterone that your body produces. These are forms of testosterone that are used in the shots, because they are typically slower. They're esterified, which means your body has to kind of metabolize them to turn them into testosterone. They're typically suspended in some sort of seed oil, and they sort of gradually convert into natural testosterone. But the process of that conversion and the sort of, I mean, I would argue unnecessary um, compounds that they're bound with, are the primary sources. Those additional esters that they're bound with are the primary sources of the side effects in all likelihood. Whereas the bioidentical testosterone, which is exactly the same as the testosterone your body produces, typically you're going to get that from a compounding pharmacy, and typically that's going to be in a cream. So, or a pellet. Some of the pellets do use, in fact, because with a pellet, the pellet structure is what's providing the time released component versus the fact that it's like this esterified Franken testosterone. Instead, with the pellets, they're like, oh, we're going to put them in these little pellets, and the pellets are going to dissolve. But still, we see with that this sort of, you know, peak and trough pattern, frankly. So, there's not really a perfect method, um, because, it's not everybody likes the creams because you got to do it every day. But I mean, look, to me, just make it part of your daily routine. And there's so many things that people do every day. Why not just, put on a little testosterone cream? The key thing is to make sure you're doing it at a time where it's not going to rub off on a loved one, because you don't want to do it right before you're going to be intimate with someone, because um, it can transmit with skin to skin contact if you apply it and then, rub that particular body part on another person within about an hour. Um, that's not ideal. So, yeah, so that's a lot of the side effects, I think, come from the forms that get used in the shots, and just that peak and trough that you see with both the shots and the pellets, even though the pellets do often use bioidentical testosterone. Um, and that, I mean, arguably, I think the pellets may be better than the shots in that regard for that reason. But I mean, you also have to ask yourself, what's in the pellet, right? What are they making these pellets out of that's causing them to time release over the course of weeks,
Mm.
I mean, everything's a trade-off, and so I would just evaluate it and use your own judgment and, look up the ingredients, check their toxicity. I think some of those pellets may actually be like patented, and so they may not even tell you what all the ingredients are to them, which I don't like that either. I like knowing exactly what's in something if I'm going to take it or prescribe it to a patient. Um, okay, so what was the question you asked again? Because I think you asked a different question. Oh, you wanted me to launch into the four stages that I go through with patients. Yeah. So the first stage I look at is precursors. So I'm going to share my screen here. I want to go over um, the upload the this is the sex steroid synthesis cascade. And all the sex steroids, whether we're talking about progesterone or if we're talking about the estrogens, they all start with cholesterol. Cholesterol, that's one of the reasons why I think, driving cholesterol down is such a problematic thing for so many people, is not only because cholesterol makes up to a third of our brain mass, but also because it's the precursor to all the sex steroid hormones. So, just sort of indiscriminately, willy-nilly assuming that, oh, lowering cholesterol more and more and more is not going to have any negative effects on people, I think is problematic. And in fact, the rate limiting step in sex steroid synthesis, in other words, sort of the step that is the brake on the entire rest of the cascade, is this cholesterol side chain cleavage enzyme that converts cholesterol into pregnenolone. And so I found in many patients that even just optimizing pregnenolone levels will help bring cholesterol levels down naturally. Because then the body says, oh, I have enough pregnenolone. I don't need to make any more cholesterol. So then from pregnenolone, we get to go into 17 alpha hydroxy pregnenolone. And then now we get into the androgens. The first sort of androgen precursor is the dehydroepiandrosterone, more commonly known as DHEA. And from DHEA, you can either go into androstenediol or androstenedione. Both of those used to be available over the counter. They're no longer available. They were taken off the market. I think they were probably competing with testosterone prescriptions, and so doctors didn't like that. Um, and so got them pulled off the market. Testosterone itself, the cool thing about androstenediol, by the way, is that it only converted into testosterone. So it's kind of like the optimal precursor for if your goal is to just up your testosterone levels. But they took that off the market. Androstenedione was problematic because it can convert into estrogen, estrone in particular, which is the pro-proliferative, pro-cancerous estrogen that predominantly activates estrogen alpha receptors, which is the sort of pro-proliferative, pro-cancerous estrogen receptor. So we don't really want too much estrone in men or women, frankly. Um, but androstenediol, though, was really nice because it just went into testosterone. But as you can see here with the aromatase enzyme, which I talked about earlier, that can cause the testosterone to convert into estradiol, which is one of the two main metabolites of testosterone. And as men get older, that level of aromatase goes up. So more on that in a minute. And then 5-alpha reductase is how we get from testosterone into dihydrotestosterone, which causes male pattern baldness. It causes prostatic enlargement, and it also causes you to it literally puts hair on your chest. So this is the predominant cascade for the sex steroids. And what I would just say is that when you come in as a patient in our practice, we often take a look at um, certainly in our concierge practice, we're taking a look at all of these sex steroid hormones, all of the major ones in this whole cascade. Um, and looking to see where the breakdown is. So, if you have low cholesterol, the first thing we're going to do is give you some cholesterol. We're going to make sure your diet has more fats in it so your body can synthesize cholesterol. And believe it or not, we do see people who have low cholesterol, and so therefore their hormones are low. So we start by getting their cholesterol optimized. If your cholesterol is below 170, you have low cholesterol. If it's below 150, your total cholesterol below 150, you have dangerously low cholesterol. Um, so then we look at pregnenolone, and if pregnenolone is lower than 75, really we like to see it between 75 and 150. And if it's below that, then I would say, it's certainly suboptimal. And we want to optimize pregnenolone. And, then really give, my philosophy, and this is pretty distinct. I mean, it's not how I think most doctors practice. Most doctors go straight for the estrogen or the testosterone or the progesterone, kind of the end products, and say, well, let's supplement those. I do the opposite. And I think it absolutely works better with far fewer side effects. I say, look, let's give cholesterol if it's low. If it's normal, this pregnenolone is low, we'll give pregnenolone, see what the body does with it. Sometimes just giving pregnenolone is enough to get progesterone and DHEA, and maybe even testosterone where we want it to be. Let's say pregnenolone looks good, but DHEA is low. Then we'll give DHEA and optimize DHEA. And once DHEA is optimized, then if testosterone is still low, unfortunately, we can't give androstenediol anymore. So then what we have to do is move to the second stage of what I do in the practice. So did you have any questions about stage one?
Mm.
Okay. So stage two, I think we can go ahead and stop the screen share. I may come back to it in a minute. But stage two is when we're now looking at using natural medicines, nutraceuticals, botanicals, herbal medicines, food-derived medicines to encourage, like we've got the precursors all on board. We've got the pregnenolone, we've got the DHEA, everything is optimized, but testosterone is still low. Well, one thing we want to look at is sex hormone binding globulin. Sex hormone binding globulin is a protein in the blood. It's a form of globulin that binds your sex hormones. So that's going to be your testosterone, your estrogens, and then maybe a few others. But those are the predominant ones that it binds. And if the levels of sex hormone binding globulin are high, then that can cause free testosterone to be low, even though testosterone itself is normal. So then what we want to do is work on bringing that sex hormone binding globulin down. The main things that raise sex hormone binding globulin are going to be low thyroid function, elevated estrogen, as well as sometimes it's actually pretty genetic. There's a lot of genetic variability in SHBG production. But we have a few things like boron, like Urtica dioica root, which will help lower SHBG levels in addition to addressing some of those other factors if those are also, like if the estrogen's high, we bring the estrogen down by blocking aromatase. So, um, yeah, I mean, I think that there, and that's just like one axis of how we might address, for example, low free testosterone. If total testosterone is low, then often we want to work on stimulating the pituitary gland, and or the hypothalamus to produce more of that GnRH. But if or and usually we're not measuring GnRH because GnRH levels fluctuate significantly throughout the day. What we're going to measure usually are like LH and FSH, the same kind of things we're going to measure in a female, because those hormones will also be, those are part of the signaling pathway that signals the testicles to make more testosterone. And if the FSH and LH are both elevated, then we know that the problem is testicular, and we can focus on improving actual testicular function. If the FSH and LH are low, and testosterone or normal and testosterone is also low, we know the problem is in the brain. And so we can actually stimulate LH and FSH production and GnRH production through use of herbs and that kind of thing. So I'm not going to get into too many details on that, but it's just that's basically the second level approach is using the herbs, the botanicals to to address the particular causes of low testosterone um, from whatever perspective is most indicated by the lab work. Um, any questions about stage two?
No.
Okay, I'm gonna have something to drink here. Um, so what's stage three? Stage three is we start to use drugs, and there's two primary types of drugs we use. One is actually an endocrine disruptor, which is kind of funny. But the basic idea there is there's a type of endocrine disruptor that rather than acting as a xenoestrogen, actually blocks the effect of estrogen at the pituitary. So what we're doing is we're blocking the estrogen that's in the system from binding to the pituitary and blocking the GnRH signal from coming to the testicles. And so as a result, you end up with more GnRH production. So you end up with more um, uh, testosterone production. And that medication is called Clomid or clomiphene citrate. And Clomid is often used to stimulate um, the ovulation in a woman for someone who's trying to do IVF. They'll often do Clomid to kind of help uh, the follicles mature and kind of get it's a fertility enhancing drug often used in women, but it can be used in men too for that very reason that it's helping to increase testosterone levels. It also helps in through the same mechanism, the Sertoli cells that produce the sperm, it helps improve their function as well through that same mechanism. So it's an interesting medication. It's frankly underutilized. A lot of urologists will use it that know about it, but excuse me, a lot of GPs and testosterone replacement people don't really know much about it. But it's a good way to encourage the body's own production of testosterone once all the precursors are in place and you've dealt with things like high sex hormone binding globulin and other things that can get in the way. That can be an additional tool that's really helpful. And really, I think in the case where FSH and LH are normal to low should always be tried first before going to TRT. The other big thing is if someone has high estrogen, and that can be estradiol, estrone, high estrogens, period, especially in a man, blocking the conversion of testosterone into estrogen is another good way to increase testosterone levels. And we can do that with herbal formulas, and we can do it with a class of medications called aromatase inhibitors. And usually I just give the aromatase inhibitors literally once a week is all you need to do. And my favorite is letrozole because that has shown to have the highest testosterone boosting effect. And literally you give, um, I think it's some ridiculously low dose of letrozole, and it's literally once a week. You might could give it twice a week, but I don't think that's going to have that much of additional benefit. And but yeah, I find significant testosterone improvements, especially if you're overweight or obese, because what you have to remember is fat cells produce estrogen. And so you're going to automatically be making more estrogen because of the fact that you have extra fat. And so often using even if your estrogen is even high normal, then it's often a reasonable thing to take some sort of a low dose of letrozole or other aromatase inhibitor to block that conversion of testosterone into estrogen. Um, I think that's all I had to say on stage three. Did you have anything
I
else?
do.
Yeah.
I'm curious about so
Oh, and by the way, Some people, even when they're taking testosterone, need to be on some sort of aromatase inhibitor to help keep the testosterone from bleeding over into estrogen. So it's very common, and we can do that in one of two ways. We can either usually do some sort of herbal aromatase inhibitor in with the testosterone. That has, varying effects, I would say. Or we can actually give a once a week letrozole along with the testosterone, and then that helps keep the testosterone as testosterone. And you can also, for the people who have high 5-alpha reductase activity and elevated dihydrotestosterone and are getting balding, or maybe their chest is too hairy, or maybe their prostate is too large, we can also give either Proscar, Propecia. Propecia is the lower dose. Proscar is the higher dose, and then we can also use dutasteride, which is a more comprehensive, like if you have a really large prostate, it's good to take dutasteride or just totally blockade any DHT production, just to keep all of that testosterone as testosterone. Um, Go ahead.
So if you were to evaluate patients, um, how would you discern, who's a great candidate for stage one? I think everybody should, be filtered into stage two. But what's the difference between like, okay, I got to start this person on stage three or even stage four, and would you let them pick?
Right. Well, we do believe in free choice, and I'm going to answer that last question first. We believe in free choice in this practice. So, I am pretty flexible with patients, and if they're like, "Hey, I really want to go straight to stage whatever," like that's something that I'm almost always willing to entertain unless I think it's going to be dangerous to them for some reason. Um, so that being said, I almost always recommend that people start at stage one, because I think that I've just seen it over and over again that providing the right precursors will correct hormone levels without even having to worry about, you know, I mean, taking additional herbs or taking drugs or taking testosterone replacement therapy. And the benefit of stage one is you're giving the body the precursor, you're giving the body what's missing, and then letting it decide how much to make and what to do with it. And, often it does the right thing. So, and I would just say that again, every single approach, we're sort of gently encouraging the body with stage two. We're encouraging the body a little more strongly, I would say, in stage three. And at stage four, we're giving up on the body. We're just saying, we're done. We're done working with you, body. You're obviously not able to do this by yourself. We're going to just go ahead and prescribe, and we're going to give the body a certain amount of testosterone. And again, the problem with that is there's no feedback loop there. There's no, oh, the level is too high, let's stop the production a little bit, or this is kind of the limit. Maybe we should back off a little bit. It's literally up to the patient and the doctor to some degree to be doing the checking every 3 to 6 months and evaluating the dose and adjusting the dose as needed, to get it and keep it where it needs to be. Yeah.
It makes sense. Thank you.
Yeah. What was your question again? Oh, how would you know? Oh, that was the second part of the question. The
Yeah.
first part of the question is how to know where to start, right? And I think I didn't really quite answer that. So, if you don't even know what your testosterone level is, I would always start with testing it, and then typically starting with stage one. I mean, that just seems like a good starting point. Making sure your precursors are in place, checking the rest of the hormones, right? Checking the rest of that cascade. I would say if you're younger, that definitely has me think more stage one and then work your way through. Um, if you have, but I'm also sympathetic to people don't, it's tough. I had a patient one time who was a young guy and he had like a wife and a kid, but he had some sort of androgen, some sort of super active aromatase where his body was just way over converting his testosterone into estrogen. And he was just like adamant that I prescribe him testosterone. And I was like, it doesn't, I mean, it's just going to make this worse, bud. Um, you don't understand that like you're going to get worse estrogens. He was already getting gynecomastia, and I was like, we have to put you on letrozole. We have to put you on aromatase inhibitor. So I prescribed it to him, and he left the door. He walked out, and I don't think he never came back because I think he went and found somebody who would prescribe him TRT, which again, I mean, was just going to make his problem worse, which was tragic, because I really was very willing to work with him. And if the letrozole had not effectively like elevated his testosterone, which I mean, the research shows that it will in people who have his condition, um, but he just didn't, for some reason, for him, psychologically taking a drug was worse than just getting testosterone, I think. And the problem with that is that the testosterone was just going to feed his estrogen machine and it was going to make all of his symptoms even worse. So, there are times like that where, I'm just going to be straight with you. And if you have that kind of a situation, it just makes sense that you take the letrozole. And, at the dose we're using, which is again, it's like once a week, low dose. Um, there's no reason not to do it if you have super high estrogen. So as a man, Um, but yeah, I think that depending on what your labs show is kind of also helps to orchestrate it. Like if your labs are way off and for example, if your FSH and LH are real high and your testosterone is real low, and your estrogen is also real low and your dihydrotestosterone is real low, then it may make sense to go straight for stage 4, right? Um, but if you're if part of the picture looks good, but some of the picture is off, we may want to go at a different stage. So it's better to get it's easier for me to give certain examples clinically. Like if I have that, I talked about that guy who really needed stage 3, right? I talked about who would need stage 4. We talked about stage 1 basically as somebody who's like, I don't really know, or I'm noticing that I have low precursors or my cholesterol's low. Stage 2 is interesting. I would say if someone's precursors, they know that their precursors look good, but some of the other labs are a little bit, you know, off, whether that be high SHBG, whether it be high estrogen, high dihydrotestosterone, whether it be low FSH LH with low testosterone, right? Like all of those things we can help with herbs and nutrients. Um, a lot of people don't know which herbs to take and at what doses and what the studies have shown. And they'll often take some random formula from some random website, which is not necessarily effective. And some testosterone boosting formula that's like some kitchen sink product that's got a proprietary formula where they don't tell you how much of each ingredient is in it, which is a huge red flag. Um, so really that's the benefit of working with a doctor is because you're using products that have clinical validity, that have, at doses that have been effective in clinical trials, and we know how they work. There have specified amounts of the actual ingredients in them. They're third party certified to actually contain that amount of those ingredients because, we don't have um, random spot testing of like the actual that the quantity is like they do with pharmaceuticals. They actually have like check the dose to make sure it's what it says on the bottle. They don't do that for nutraceuticals. Um, Now there are companies who do that, and you want to use those companies and not the other companies. But the vast majority of companies out there don't do that, and that's called third-party testing. The other thing is you want companies that use GMP certified manufacturing processes. So that's good manufacturing processes, and you want grade A, which is like the top tier, which is basically the same practices they use for manufacturing drugs. But again, the majority of nutraceutical companies don't do that. So look, I mean, I'm not saying that the nutraceuticals that I prescribe in our practice are the cheapest things in the world. They're not, but you get what you pay for, right? So. Yeah.
Pharmaceutical grade, physician quality
Yeah. So
versus some rando website or off of Amazon.
Testo
Um,
Boost. I don't know. I don't even know if that's a real thing, so please don't come after me if your product is Testo Boost. But I'm just like, there's so many of those out there, and I'm just like, because they all have a little bit, like it'll have a little bit. And the thing is, when you have like a proprietary formula, right? It'll be like 2,000 milligrams of a proprietary formula. It could literally be like, 18 or like 19,000 990 of one of the products in that list, and then one milligram of each of the rest of the products. And there's no way for you to know, right? So that's why proprietary formulas are almost always a scam. I say almost always because there are some super reputable companies who do have some proprietary formulas, but because it's like a rare thing and the rest of their product line are not that way, they I and they do third party test their products. I might consider a proprietary formula from a company like that because it's like, hey, it's got a proven track record, especially if they've done a study on it and have shown that it's effective. Um, that is where proprietary formula may in fact be helpful, but that's those are few and far between.
the intention of having you communicate with such thoroughness and comprehensiveness is to invite uh, men of the world into true informed consent when it comes to uh, testosterone. That you do indeed have choices, and you do indeed have the choice to be um, be guided and what's the word I'm looking for? Guided and also
I'm not sure, but I guess collected, I don't know, or supported.
ex masterfully supported.
Yeah, I mean, I guess what I would just say is most people don't even know that these options exist.
Right,
Like most people are aware of like option four, and that's it.
right, because
And I think
that's what is heavily marketed.
and I think some people that's all they want, and that's fair. I get that, but I think the vast majority of people who are dealing with either low testosterone or the symptoms that they think might be related to low testosterone probably would prefer option one, two, and three before going straight to option four if they knew that those were options. If
Yeah,
they knew that those options existed.
absolutely. And if you kind of push pause on the instant gratification monster that you um I mean, I don't know how so many men are ready for those side effects. Benefits, but like massive side effects.
Yeah. Well, I
Yeah.
mean, I think that the side effects vary, obviously. I think that for me, the biggest problem is with the different injectable forms because those have to be metabolized prior to becoming active. There is a potential for liver toxicity, and we do see that with testosterone, the injectable forms.
And
um
I was just
you
talking
know
about men who um, are great candidates for stage one, stage two, stage three.
sure.
But we're that gentleman who walked out of your office and
Yeah,
said,
yeah, I mean, I just yeah, it's one of those things where I think people have to be open to it,
and
and
not
then
only open, but retrained,
yeah.
re-educated, reprogrammed. Because there's just mass marketing everywhere. I mean, I
Well,
think
and I
that,
would just say that your body really is designed or evolved to produce sufficient levels of testosterone, if the conditions are correct. And I think that that is something that we've lost sight of as a society. Now, testosterone levels do naturally go down as we get older, and I'm all for supplementing as an anti-aging strategy. And so I think that kind of where I say, hey, when your levels start to really drop, and again, average 65, some minutes 50, some minutes 80, right? But it's sort of like really does depend on the individual. And that's why testing is an important part of it.
Absolutely. Yeah. I mean, I drive by this spot where it says testosterone, terzepatide, all these. Yeah, I'm not quite sure about the level of testing or the level of care that you receive in places like that.
Yeah.
But
Yeah. All right. Any other thoughts about that?
no, I'm excited to roll out a program that honors the individual and to present to them these four options,
Yeah.
and really educate people, like re-educate people, and have it be known that look, you have choices.
Yeah.
Yeah.
Yeah, look, and I think that that is a distinct element. And I think that if people were available, there's going to be a lot of people who, there are people who are happy with the shots and happy with the pellets. I'm not saying that there aren't, but I would say that a lot of people, there are also a lot of people who either those didn't work for, or they were unhappy with the side effects, or who just aren't going to do that because they're just like, that's not me. I want to do something more natural. And I think that, the approaches that I prefer typically are, going to be effective in those people. And honestly, I mean, people who are rolling around with a 200 or 300, testosterone level, I mean, for them, even sometimes bringing it up by 100 points is enough, is a game changer
Mm.
for them. And I think, and that's very easy to do with nutraceuticals. I mean, usually we can see, I mean, I would say 100 points is easy, 200 points is definitely doable for most people using natural means. And then bringing in the drugs, we can go up even further beyond that. And then, of course, with TRT, we can go dose it however we need. But I think the big message I would say is that for people doing TRT, you need to also be measuring your estrogen. You need to also be measuring your dihydrotestosterone to make sure that your testosterone is not over metabolizing into either or both of those. You still need to have your pregnenolone and your DHEA optimized. So just because you're not taking the precursors in order to up your testosterone, you still need to have those precursors because pregnenolone and DHEA have separate physiologic benefits on memory predominantly and longevity, because we know that people who typically have higher levels of those hormones tend to live longer. And you need to have those in your system, whether or not you're taking the TRT or not. So, you know, looking at the whole picture is really a big part of it. And ideally looking at the whole person, but I would say even if we just focus on testosterone, there's obviously like this whole landscape that can affect it. And I think that by looking at those different elements and addressing them, you're going to get a much better um, side effect profile, longevity benefit, um, ultimately consistent levels, and everything in between.
You have a right to the whole picture.
Yeah,
Yeah.
absolutely. Um, okay. Is there anything else you want to talk about today?
No, that was fantastic.
Okay,
Thank
great.
you.
Well, I'm Dr. Ryan Partovi,
And I am Mrs. Madi Partovi.
and this has been the Partovi Effect. Thank you for joining us this week, and until next time, be well.